begin. So I am Becky Facina. I am Alliance Health's Community Education Specialist, specifically in Johnston County. I'm very happy to be here, and thank you all to our panelists for being here. For those of you that don't know us, we are the local management entity, managed care organization. I know it's a mouthful for public behavioral health care in Durham, Wake, Cumberland, and Johnston counties. And again, I serve Johnston County out of our Smithfield office. We serve about 471,000 Medicaid eligible and uninsured individuals among a total population of over 1.7 million in our catchment areas. And we manage a network of providers ensuring quality care is received, as well as help individuals access care and navigate systems. And we know in this day and age that accessing care is so incredibly important. We also have a 24-hour access and information line there on the screen for you, and that number is 1-800-510-9132. A couple of items I wanted to share before the panelists begin and we introduce them are some things that we have that Alliance is working with our state in partnership with the state to get this out to our communities. This is the Hope for North Carolina helpline. It connects North Carolinians to additional mental health and resilience supports that help them cope and build resilience during times of crisis. It is available to everyone in North Carolina's 100 counties during the COVID-19 crisis. So Hope for NC includes a crisis counseling program, and it's tailored for COVID-19, which will provide immediate crisis counseling services to individuals affected by the ongoing COVID-19 public health crisis. So it's now available and has been available 24 hours per day, 7 days a week to speak to a live person there. And that's the 855 number there. 855-587-3463. And then finally, I wanted to touch base about the National Suicide Prevention Line, Lifeline, for those of you that don't know about it. It's a suicide prevention network of over 160 crisis centers. And again, they provide 24/7 service via this toll-free hotline number. It's available to anyone in suicidal crisis or emotional distress. And I am very happy to share with all of you that as of July 16th, 2022, so we're still a few more years away, the National Suicide Prevention Lifeline will be reached by dialing 988, so essentially a 911 number. This number is 988. So on July 23rd, the FCC unanimously voted to finalize this 3-digit number for Americans to contact the 24/7 national hotline. And I just think that that is amazing, and it's fabulous that we have that at our fingertips. So without further ado, let's get to our guest panelists. So this panel, the first in a series, it's going to feature Pastor John Jernigan of the Lighthouse Church, Dr. Marilyn Pearson, Director of Johnston County Public Health, and 2 representatives from the Alice Aycock Poe Center for Health Education, Jessica Fowler, Substance Use Prevention Specialist and Bullying Prevention Manager, as well as Youth Mental Health First Aid Instructor, and Lauren McCullum, Assistant Director of Nutrition and Physical Activity.
Who are you talking to?
1 second, please. Hey, baby, I need you to go. I'm in this big meeting. Bye-bye. Say wave and say bye. Okay. We are all working from home these days, so there is my beautiful daughter in the background. Thank you, love. Each panelist is going to discuss their organization or agency and highlight programs, events, resources, and information that may be valuable for this audience to hear. Panelists, if you have any flyers or contact information to share with the audience, I'm happy to send it to our registrants once this event is over. So we will make sure that all of our registrants get this important information. So again, thank you. Sorry for my little photo bomb daughter, Evangeline. She is 5. So without further ado, hopefully Pastor Jernigan is on, or Pastor John, are you with us right now? If so, could you please unmute yourself or turn on your video? And we'll give him a moment to see. I was hoping he would make it, but it looks like he is having Still a few difficulties. So then, oh, nope, that wasn't Pastor John. So then, Jessica, if you don't mind, do you want to just roll through? If he jumps on towards the end, we can include him. He has some really great information, but it sounds like he's having some technical difficulties.
That's fine, thank you. And I'm really jealous of your coworker. That was a great treat.
They keep me on my toes.
Of course, very cute, very cute. So hi, I'm Jessica Fowler from the Poe Center, and I am here with one of my coworkers, Lauren, and we're going to be talking briefly about the Poe Center today. So some basic information is the Poe Center is a nonprofit organization that's main office is in Raleigh, and we provide health education programs to groups all across North Carolina. The programs are available to any school, organization, such as a faith community, a boys and girls clubs, things like that. And they range from pre-K all the way to adults. The program content is not things we just made up. So they're actually based on the NCDPI Healthful Living and Science Essential Standards. They are research-based content as well as evidence-based educational methods. And we have found that our programs are very effective and they're valuable, and we're one of the only ones in the state that do programs like we do. We do have several program areas. So we do general health, nutrition and physical activity, family life, dental health, cooking and gardening, bullying prevention, and substance use prevention. It is also a field trip destination. We know with COVID that's a little hard, but we are going to show you a couple of clips of what it would look like if you were able to come to Poe, which we hope one day again will happen. So right here is our Cranium Connection. It's where youth will come in, they'll learn, go inside, they'll learn about the brain and how to keep the brain healthy. And this is our Family Life. This is where they learn about puberty, sexual health, along with healthy relationships. We have General Health, where they learn all about their health, their body systems, germs, things like that. Then we have Dental, which will then learn about how to take care of your teeth, oral hygiene, the purpose of flossing, all that fun information. We have our Grow Well Garden, which is grown all year round with seasonal vegetables and fruit. It's a very interactive garden. So they learn about things like the parts of the plant, all the food that is grown in our garden, including herbs, are used in our kitchen or are donated. And then this is our awesome kitchen we opened 2 years ago. It's very interactive, big screens around so you can see no matter what view. So we do cooking classes in here as well for youth and adults. And then we have our awesome Playwell Park. Before COVID, it was open during Monday through Friday during business hours. Right now, till playgrounds can open again, it is closed. But it's really fun. It has a lot of healthy activity tips around the playground, as well as it's very just fun and adventurous to play in, along with picnic areas. We have bullying prevention, that we talk about the healthy friendships and how to have awesome kindness towards others, how to be a defender for other people. And then we also do nutrition and physical activity. So that's all about healthy eating, how to keep our bodies in good condition by using physical activity. And then we have substance use prevention, which we just updated the theater last year to where it's very science-based and it will never go out of style because it does show things about the brain, chemical compounds. So I'm going to go a little bit more into that in just a second. So the Poe Center has gone virtual with the need to meet the needs of the communities that we work with, which is across the state with COVID. We've always offered supplemental health lessons as well as interactive online exhibits on our websites. And we also do have a YouTube channel that we do have videos on. Our programs are offered in multiple formats. So we do have in-person. We are doing some in-person still. But we also have live online sessions. So if you go to our website, you can see a list of all of our programs. And if one doesn't show that's online, you can contact us and we can modify that program to make it and tailor it for what curriculum you need and to get it to be online for you. So let's talk a little bit about substance use prevention and specifically for Johnston County. And that's where I do majority of my work along with a couple of my team members who are not present with me today. But some of the things we do is we provide those one-time education programs to Johnston County. We were going out in the community and doing those, working with schools or churches or other partners to be able to set up those programs, and they would host us to be able to do that. We also do what we call a continuing education program. It's about 10 sessions called Too Good for Drugs or Too Good for Drugs and Violence. It's from ages 3rd grade through 12th grade. And we can do this in the school. We can do this at youth groups, boys and girls clubs, after school programs, anything where there's youth, we can do it. And right now it can be done virtual. So we have no problems if anyone's interested to be able to have that, and it does not cost anything at all. We also do more than just provide education. So we work a lot in the community. We work with merchants. We provide education to the merchants about, that sell alcohol and tobacco to prevent underage purchasing of those products. But we also work with a lot of the local collaboratives and coalitions. One in particular is the Johnston County Substance Use Prevention Coalition. And if you're interested in that coalition, feel free to contact me and I'll get you some more information for it. So we do a lot of work with those. We partner and we work on all different kinds of things. So it's really exciting work for us and we love doing it to help out. One of the things that we find really important is locking up medication. So we work with community partners to provide education on the importance of locking medications up. So that means even, going to medication collection events. We provide education then, as well as providing lock boxes to people in the community that need a lock box to lock up those medicines, and medication disposal kits, which have a chemical in it that you can dispose at home. But we also provide information if that kit is not available and you're not able to get to a permanent drop box location on how to dispose safely at home. So if you know anybody who needs a lot box or an upcoming event, we would be glad to come and hand out lot boxes to families that would like one to be able to get those out. Another great exciting thing we are doing is youth empowerment groups, and those is a program that's for 8th through 12th graders, and it's geared towards ages that are interested in being leaders and advocating for policy and community change in their communities. So one of the things that they will focus on is it would mainly be substance use prevention. It could be things like youth that are very interested on reducing vaping rates with their peers, alcohol use, things like that. So they'll learn awesome leadership skills, public speaking and presenting skills, and then they'll get to utilize them. So it's not just learning it, they actually use them. They'll get firsthand experience working on policy work and change and learn how to advocate for those changes, going to public officials, things like that. They work with leaders in substance use prevention along with the community partners and local coalitions. They are not seen as a young person in the coalition. They actually get to have leadership roles and they're very engaged. So if you know a youth or a group of youth who would be interested, my information will be at the end. We would love to work with them and help them out with all those things and focus on the areas that they would like to focus on. The other thing we have, as Becky already mentioned, is youth mental health first aid. I'm an instructor for that. So if you are interested in that training, you can feel free to contact me. Becky and I sometimes even tag team them. So I have my email listed and you'll be able to do that. All right, Lauren.
Lauren, unmute yourself. That's okay.
Oh, there we go. Okay. I'm on. Can everybody hear me? I hope.
We can.
So I see a lot of familiar faces and names up here, but if you haven't met me before, my name's Lauren McCullum. I live in Johnston County and have been working with the Johnston County School Health Advisory Committee for probably about 5 or 6 years. I've been with the Poe Center for 11 years. Came on to teach field trips. I'm an educator and not used to virtual. So I do want to say if anyone has questions or comments as I'm speaking, please feel free to unmute yourself or to put it in the chat box so that I can address it. I work primarily with our SNAP grant, which is the federal grant that we have, or state grant that we have, to work with SNAP participants, SNAP recipients, which is people that may receive free or reduced lunch or help with food. So what we mostly focus on is nutrition and physical activity and encouraging that within our community and within our schools. So this picture right here is at Cooper. This is our preschool program series, teaching nutrition. They're making little faces using all the food groups. I'm just going to show you a couple examples of things we've done in Johnston County. You can go on. Okay, we have some Be Well schools in Johnston County. These are some schools that Poe has sort of worked with for a number of years to try to really implement some policy system environment change in the community. We did work specifically with schools that are low income. We've been with South Smithfield for 4 years, Glendale Kinley, this will be our second, and we were going to be starting with Cooper this year. So hopefully we're still going to be able to do quite a bit with these schools, even though it will be virtual for a while. We have received grants to do a bike club, both at South Smithfield and also at Glendale Kinley. Those are some of our Smithfield students with their bikes. And we are really excited about the Eat a Rainbow week that we've been able to implement, or help to implement. We really haven't. The school, let's see. So South Smithfield Elementary, the first year that I was working with them, we tried to do an Eat a Rainbow week. And so basically it's like Monday is red, Tuesday is orange, Wednesday is yellow, so forth. So that all week long, the students are focusing on vegetables and fruits that are that color. Over the years, it's sort of evolved into working with Child Nutrition Services, and it's a county-wide attempt to get schools involved. You can move the slide. There's a picture of us I'm the mascot, and with Laura McCullum at South Smithfield and some of the students. I think that was the second year we did it. We also have been involved with Walk and Bike to School Day. That's a really fun activity, and we usually are there to supplement some, thanks. We're there to supplement the program or supplement the walk with some nutrition information. Sometimes we give out some flavored water, and there we're giving out some incentives. This is something that I was really excited about that we were in the middle of when Corona hit. We have been able to work with Partnership for Children to do a Mom and Me or Parent Child or Caregiver Child nutrition series. So the premise was it would be similar to something like Kinder Music or Gymboree or something like that, but we would work with Partnership for Children. And what we're providing is our same nutrition program that we typically would do with a preschool class, but instead it's a parent-child. And that's so important and so effective because preschool children don't really make choices about what they eat. So getting the information out to parents get to see their children tasting different fruits and vegetables. Parents also are maybe experiencing some different fruits and vegetables that they haven't had before. And it's really a positive interaction. We were working on, I think we got to about session 3. We had one program for about 30 minutes that was in English, and then we had a second program that was in Spanish. And it was really uplifting because the Spanish program was actually better attended. It was great. So hopefully someday we'll be able to go back and finish that. We are involved with the Summer Food Service Program, and all I wanted to mention on this is that I was able to work with the PE teacher at Glendale Kinley and pass out some nutrition education materials while they were picking up their meals. probably, it was before school ended, probably like April, May. This is a tower garden. That's something that we got for one of our other Be Well schools. It's an example of something that we would be able to write a grant for. And this is a walking path that they also put in at another of our Be Well schools, but not one in Johnston County. Oh, and we, over the years, have evolved into working with seniors. So I've worked a lot with the Smithfield Senior Dining Center. We did a Cooking Matters program, which is a 6-session cooking program. And what we were the most excited about is they came on a field trip to the Poe Center as their culminating experience and had a great time. It was our one and only senior field trip at the Poe Center, and they had a really good time. We are hoping to get to do Stay Strong, Stay Healthy as well with Smithfield Senior Center. This is an exercise program for seniors. All these programs are evidence-based. We are going to be trained soon in virtual Stay Strong, Stay Healthy. So I'm hoping to be able to get to the senior adults in Smithfield through that program. One of the policy system environment changes that we've been able to implement over the years, Interfaith Food Shuttle does a mobile market at Temple Baptist Church. What Poe Center was able to do was work with Temple Baptist to provide food samples and recipes at the mobile market. So participants that came through to get their food were also being able to take a food sample of a healthy dish, and then we gave them the recipe and possibly some other nutrition information as well. Because we were not able to do an assessment for this program, we backed off a little bit, and what was super exciting is with funding, with some supplemental funding, the Temple Baptist volunteers were able to take this program over on their own. So that was really like a policy, like a system change, which was great to see. And these are some of my volunteers, or some of the volunteers with Temple Baptist. We do social media as well. Some of you may have seen this billboard. Now we have a new one, and it's water we're promoting now. But we do post assessments, pre-assessments for our social media and marketing every year. And if you ever go to our website, there's a lot of information on there. Okay, good. All right, so basically we wanted to leave a few minutes of time for questions and suggestions, because as you know, we are all in an experimental time right now, and we are trying to figure out what's going to work, what's not going to work. Any suggestions for programming or anything you can think of that would be helpful for our schools and then also our community during this time of half quarantine in school. I don't know if y'all can hear my teenagers upstairs.
That's fantastic, Lauren and Jessica. It's such good information, and to know that you all are housed in Wake County, just almost right in the heart of Raleigh, but you do so much work, not only across the state but specifically in Johnston County. It's really amazing. So we're going to leave that chat box open. So if people want, as we're continuing to listen and learn, people have thoughts, they want to throw that in there. And then at the very end, we can kind of have an overall question and answer session, and we can kind of go through, I can navigate those comments for you and those questions, and we can do it that way. Thank you for putting up your contact information as well. My hope is at the end of this, when I do send out the link to our video, because it is being recorded, I'll also put in all of your contact information if that's okay.
Absolutely.
Perfect.
Thank you so much.
No worries. Thank you for being here. So I don't know if I should say we saved the best for last. Probably the person that's going to have the most questions and comments directed toward her. If Dr. Marilyn Pearson is on, if you wouldn't mind unmuting yourself. There she is. Hi, Dr. Pearson. Thank you so much. We put you in the hot seat last because I know you have a wealth of information to provide to all of us, and wanted to give you enough time and a platform to be able to share that with this group.
Hello, can everybody hear me?
We can.
Great. Well, good afternoon, everybody. It's a busy time for us, as you can imagine, here at Public Health. But I will talk a bit about what we do in general in public health, so that everyone at least has some background to understand what services we offer and how to get in touch with us. You can provide that information at the end for them. So we are a public health department for our county. So we cover all residents in the county. And as many of you all know, we have over 200,000 residents here in our county at this point. And so as a public health department, we provide multiple different types of services. So we provide clinical and preventive services. We provide behavioral health services, which is not necessarily what all health departments in North Carolina do. But we also provide environmental health services, and many people don't realize that environmental health is a part of public health. So under our clinical and preventive services department, those are our clinical areas that many people know us for. So we have an adult health clinic where we do primary care. So we do accept Medicare and Medicaid, private insurance, and uninsured. Over 50% of what we see there is uninsured. So we work closely with Project Access of Johnston and Harnett County, which is actually a part of our hospital foundation. For those who don't know what Project Access is, it is a initiative that provides health care to uninsured adults here in our county. And so there are physicians and providers in the community that actually donate care, in addition to the hospital that's donating care for uninsured adults here in our community. So we do a lot of that in our primary care clinic, and we function just like a regular doctor's office, of course, by appointment. But we do a lot of chronic care, as you can imagine there. We see a lot of diabetes, hypertension, COPD, those type of things. But we also, in that clinic, have a grant with the CDC breast and cervical cancer prevention grant for low-income women to provide pap smears and mammograms. So that's a big part of what we do in our primary care clinic. We have a child health clinic where we, again, provide primary care and a lot of immunizations, as you can imagine. But we provide well care and sick care for kids, do a lot of developmental screenings. But in our child health program, we also have case managers, care managers for at-risk children. So they work with a lot of our children in the community who may need assistance getting connected to resources and services. So we do provide that service, and those care managers actually work with, case managers actually work with children, not just at the health department, but any child 5 and under here in our county can receive those services and get referrals there. We have a family planning clinic, and it is just what we said. We provide family planning services, and we're a Title X clinic. We provide maternity services here, so we do take care of a lot of prenatal patients, but we partner with Triangle Premier, who is our OB consultant that comes in once a week and see our high-risk patients and meet those who are actually going to be delivering at our hospital. So that's our maternity family planning clinic. We also have OB case managers in that clinic who work with our high-risk women, again, trying to be sure they get through their pregnancy in a healthy way and deliver a healthy baby and connect them to services that they may need. Our epidemiology clinic is the one that deals with our communicable disease, a lot of immunizations, TB, HIV. Most people know public health for that clinic. But as you can imagine, that clinic is very active at this point, dealing with our COVID response, along with all of my staff. We also, as a public health department, provide labs in-house as a part of our services. We have WIC services here in our health department. And so we have nutritionists on staff and clerical staff that work with those who are in need. And we do vital records. So birth and death certificates, that's a part of what public health is responsible for. I'm the official registrar for the county as the health director. A big part of what we do is provide health education in the community. Of course, public health is about prevention, as much as we can, promoting health and preventing disease. So we have health educators on staff who provide education not only in our clinic areas, but a lot in our community. And they work closely, of course, a lot with our PO group. As you know, you all involved in a lot of our coalitions. But we do provide programs in the community. We work with the schools to provide puberty education, for example. We work with our senior centers, providing falls prevention programs. We do programs, chronic disease management programs for diabetes, for example. We do smoking cessation programs. So we offer lots of different programs and educational programs for the community. The other thing that we do that not all health departments do is provide behavioral health services. So we have a behavioral health unit that includes our psychiatrists and our social workers and other staff there. And we continue to provide services which involve counseling, therapy, medication management, and group therapy. So we do lots of different things there with our behavioral health unit. And then, as I mentioned, we have an environmental health department that many people don't realize is part of our health department. And those are the people who do your restaurant inspections. You see the grades in the restaurants, they are part of public health. They also do septic evaluations. If you're building a house, you probably are seeing my staff and being involved with my staff. So we do lots of different types of programs. And as I tell everybody, every decision is a health decision. So all things that you do, that we do, all involve health. So as far as our community, we have, as I said, multiple coalitions and groups. Our Faith Network group is one of our big groups that we work with. We try to get our faith community involved in initiatives and provide information to them about what's happening with the health in our community. We have an opioid task force that works with multiple partners in the community. We have a safety net collaborative that works with some of our safety net providers, those that are seeing low income and uninsured people here in our community. And then we try to provide different programs through those collaboratives. We've done some mental health first aid with a few of our faith network groups, and Faithful Families, which focuses on healthy living, healthy eating with some of our faith groups. I can go on and on, but those are lots of the things, those are many of the things that we do as public health.
Well, thank you for sharing, because it opened my eyes to so many things that I thought I knew, all that public health has their fingers in and that they touch in our community. But I really learned a lot more today. So thank you for sharing, Dr. Pearson. At this time, I'm going to, again, try and reach out to Pastor John if he is on. Please unmute yourself or your video, but I don't think he made it here today, unfortunately. And so we'll try to have him back again and rework him. I think he was having some technical difficulties. This is all a new space for all of us. And so we are all learning. It's a little bit of a learning curve. Again, with my daughter that video bombed. We used to do photo bombs and now we're video bombing. So we're gonna make it work. I'd like to open up the panel now for questions or comments. If anybody has anything that they want to add in the chat box, for a question for one of the panelists, a comment for one of the panelists, or feel free to unmute yourself. It is a smaller group today, so don't feel like we will be talking over ourselves. If somebody does have a specific question for any one of our panelists, feel free to do that now. Dr. Pearson, I'd like to ask, I guess on behalf of the audience, some of your coalitions, are they open to community members? If I was just an attendee of a church or a member of a church, is that something that I could attend on a regular basis?
Yes, it is open to the larger community. And actually we are recruiting. Anytime you go anywhere, and you all that are members of our coalitions, our faith network, our opioid task force, please invite people to be a part of our groups. We love to have more community members. You know, we've had some of these groups going on for years. Some people come, then they stop for a while and they come back. But it's great to have new members who come in. They can provide input to us and make some, you know, recommendations, and always it's great. So please invite others to attend.
Thank you. And then Jessica and Lauren, you spoke about so many of your amazing programs that you have going on at Poe. Are any of them any of them cost? Is there a registration fee, or are most of them free to the community? I know with Youth Mental Health First Aid, Jessica, because I'm involved in that, we're moving that over to an online platform, that there is a fee for that. Not that we take that fee, but it comes down from the National Council programming. And that fee is $23.95 per person that wants to attend the Youth Mental Health First Aid or Mental Health First Aid. There's an adult version as well for all of you out there. But what about some of your other programming?
Well, when it comes to the substance use prevention, a lot of our programs are at no cost. For example, the one that I mentioned that was up to 10 sessions that we can also do virtually now are at no cost. Other programs, and even some of our one-time programs as well. Any of the other subject matters, it's best to contact Poe. I don't handle any of those other areas I don't know much about. Or you can contact me and I can find out any information on that as well.
Fantastic. So, go ahead, Lauren. I'm sorry.
I was just going to say, for nutrition, if we are targeting or we're working with a group that is 50% or more free reduced lunch, we're able to do anything nutrition related at no cost.
Great. And for contact wise, and to find out that information, would it be best for them to contact the direct line at Poe and ask those questions to be connected to the right person instead of directly contacting the two of you?
It depends. If it's substance use prevention, they can contact me directly. And then if there's someone I need to talk to, I can help with that. If it's for, like, example, dental, they'd probably need to contact Poe directly.
Okay.
If it's information about the Johnston County Substance Use Prevention Coalition, they can contact me and I'll get them connected with the coordinator for that as well.
Great, thank you. And again, for registrants that are currently on, or those that may have missed this, we'll send all of that information out once the recording is over and the session is done. I do have a question here. This is directed to Dr. Pearson. What is the Department of Public Health's COVID-19 plan and services? Do you have regular testing set up? Could you tell us a little bit about that? And then what is the current status or numbers in our specific county?
Sure. Yes, we are continuing to do testing in our county. We actually had a testing event today at JCC this morning. And over the next couple of weeks, we will have 2 testing events on Tuesdays and Thursdays. So on Tuesdays, we will be at Triple S High School. Next Thursday, we will be at Corinth Holders High School, and the week after that Thursday at North Johnston Middle. Go to johnstonNC.com, our county website. We are updating information there for testing and where we're providing testing. We are trying to continue to do that so we can see what's happening really in our community. If you go to that website, you will also see our dashboard. We have a county dashboard that's updated daily, and at least Monday through Friday, not on weekends, but daily. And we have that updated. I can tell you that as of today, we have 3,179 total cases that we have. We've had 46 deaths in our county. To give you some perspective, people always ask, how is that compared to flu? We've had 2 flu-related deaths. And these 46 deaths have been in the last 5 months because we've been dealing with this, at least in Johnston County, since March. We have 33 people that are hospitalized at this point, but we have a large number of people that we say are presumed recovered. That is, we expect that it's been more than 2 weeks. They're not having any symptoms. That's at 25, 28. So we have a large number of people that are being affected by COVID-19 here in our county. We are working with multiple partners in our response, multiple county agencies. Our school system, as you know, they're getting ready to go back to school. So we are in daily contact with them. but we're continuing to monitor and see, what our numbers are looking like. We've had a pretty high positivity rate the last few months. That seems to be going down now, but we know that there is still widespread, community spread. So we are continuing to ask people to wear face coverings and wash their hands and wait 6 feet apart. That's something I think that all of us can do to try to decrease the spread of this virus.
Great, thank you. I believe this one may be directed towards you as well, Dr. Pearson, so you might want to keep yourself unmuted. This is in reference to behavioral health. This is a member of NAMI Johnston County that's asking this question. Is there anything new in the works to further help those living with mental illnesses? And I'm not sure if that's programming or other resources. Is there anything if you can address that?
I don't know that we have any new programming. I could probably, when we get my contact information, we can get more information to you about resources and programs, specific resources and program that they can provide to you. I know that, with COVID-19, there's a lot of stress and anxiety going on. We're having, and told today that there may be some community health workers that are going to be working with some of our teams to try to connect people to services. So that may be coming for us soon, just to at least be in the community and help people get connected to services.
Great, thank you. And then we have, I'm going to say Ms. Sanchez. I think it's Ahira, but I don't want to butcher your first name. So Ms. Sanchez has just posted some information here for any of you, her contact information. She works with NC Cooperative Extension and works with programming for Spanish-speaking families. So there's another resource out there if anybody wants to collaborate with her and talk about some virtual programming. Her information is there in the chat box as well. We have a storm coming through here in Clayton. I don't know where everybody else is currently. It has gotten dark, and so I'm hoping that the lights don't flash and the electricity doesn't blink and lose all of us. But again, I wanted to thank everybody. I also wanted to put a plug for this. I know we had a smaller turnout today. We did have approximately 40 registrants, but we all know that life happens. And so I'm so thankful for those that were able to connect with us and be with us today. Presently, but again, we will share this video, this recording far and wide. If you do have interest in being a panelist, I have several others that are kind of in the pipeline that I already have lined up, but I am really hoping, and my vision for this is that we continue to do this maybe on a bi-weekly basis to continue to get those resources pushed out into our community. We really have to be thinking outside of the box during this day and age. Outreach looks so differently, resources look differently, connecting to the community is so much different. And so really trying to be thoughtful about how we can do this and keep our community members connected to the resources that they need and the people and the connections that they need to be connected to. So again, I thank you all for your time today. It was such beneficial information. Thank you, Jessica. Thank you, Lauren. Thank you, Dr. Pearson. We know your time is valuable. All your time is valuable, but we know the work that you're doing, Dr. Pearson, in the community is so important, and your time is so valuable. So thank you for taking the opportunity today to sit here with us and be with us.
Thank you for holding us. Yes.
Yes, thank you, Becky.
Susan, we will get you some more information about NC360. I can connect you to that. If anybody wants to speak, Dr. Pearson, can you speak a little bit more specifically about that platform before we go?
NC Care 360 is a platform. If you're familiar with 211, it actually merged. Essentially, United Way is working with them, and it is really trying to connect people again to those resources in the community, like transportation, food, mental health, medical resources, etc. But it's really kind of forming a bridge to fill those gaps so that people can get to the resources they need. It's out there, and you don't have to access it through a medical provider, etc. You can actually access it through 211 and United Way. So if you Google NC Care 360, you'll find out lots of information about it. It's now across the state of North Carolina. And actually the community health workers that will be coming in will actually be utilizing NC Care 360 to try to get some of these resources out to people.
Great. And I'll be happy to add a link in the email that is sent to about NC Care 360 so that you will have that. Anything else for the greater good before we say goodbye? Well, thank you again all. Please stay healthy. Please stay well. Please reach out if you need anything. And I will be back in contact with all of you with not only the link to this recording, but also some great contact information from our panelists. Thanks again. Bye-bye.